phase 8, reevaluation, we got to the last phase of EMDR therapy, and we use phase 8 to assess the long-lasting effects of EMDR. We want to make sure that whatever happened last week, if ideally a client reported SUD 0, VOC 7, we clear the target, we want to make sure that we have long-lasting effects so the client comes the next week and they have the same thoughts and feelings about the target memory. So we start the session by asking the clients to reevaluate and see if we actually have these long-lasting effects. In Psychedelic Assisted EMDR, we're looking at phases 7 and 8 as integration. And we need integration for 3 main reasons. First of all, we sometimes need to stabilize clients. Second, we continue reprocessing if necessary. So again, sometimes SUD 0, VOC 7 is no longer SUD 0. The clients come back the next week and the SUD is 5 or 6. So we continue reprocessing. That means that our work with this particular target is not over. And then we also want to enhance positive effects. And that does happen sometimes. So we want to, the same way that we talked about the body scan, that we're integrating positive body sensations, we want to enhance positive effects when we're reevaluating or when we're doing integration. I am not waiting until next week to know what happens to the client. I'm asking them to email me typically the next day. I want to know how they're doing, how they slept. Sometimes clients sleep really, really well. I had a client who slept 12 hours, and this is a client with severe insomnia after his first medicine session. And sometimes they don't sleep well. So I want to know how they're doing, and I want to know the next day. And if you need to leave time for a phone call, ideally leave time for a phone call the next day if the client needs to talk more. A reevaluation or integration session should be scheduled as soon as possible after a medicine session or psychedelic assisted EMDR therapy session. So I insist that clients see me the following week. I do my sessions on Friday, so I'm not working on Saturday. Sometimes it can be beneficial to see the client the next day if it's possible, if it works with your schedule. But this is something that I insist on when I see clients for medicine sessions. They have to schedule an appointment the following week so we can do the integration. The integration is an important and big part of psychedelic assisted EMDR therapy, and it's not something that we can skip.